Hello, everyone. Welcome back to my channel, Necessary Missions, where we focus on disability, the myths and stigma surrounding disability in Africa. Today, we're going to talk about a very important topic, cerebral palsy. I'm going to start with defining cerebral palsy, and I'm also going to tell us about the symptoms and the signs that we can tell someone has cerebral palsy, also the causes, diagnosis, treatment, and afterwards we're going to dive into the myths and the stigma that people living with cerebral palsy face in Africa. What is cerebral palsy? What do you understand when you hear someone has cerebral palsy? Cerebral palsy is a neurodevelopmental condition that affects a maturing or a developing brain. This subsequently results in inability to coordinate posture, balance, and affects movement as well. What are the symptoms? What are the signs that you see with someone living with cerebral palsy? Now, the symptoms depend on the part of the brain that is affected. Usually, we talk about the brain, but the brain itself is divided into different parts. You have the front part of the brain that's like an umbrella that forms what we call the hemisphere. It forms two sides. That's the cortex. We also have the deeper part of the brain called the midbrain. And we have the back of the brain, which we call the hindbrain, and that's where you have the cerebellum as well. Now, the part of the brain that is affected depends on how this individual presents with their symptoms. Now, the cortex that I talked about is involved in sending signals via what we call neurons to effector organs. Effector organs are the ones that carry out activities like the muscles. Now, if you have that part of the brain damaged, in the cortex, you have the part that controls movement, the part that controls speech, the part that controls sensation as well, amongst others. So when you have the cortex being affected, the individuals tend to have weakness or they become stiff or spastic. And now, if you have the part that controls the speech being affected as well, they have difficulty with speech. The midbrain can also be affected, which is the deeper part of the brain as well, that we call the basal ganglia. Now, this part is takes care of involuntary movement. Now, when this part is affected, the individual is unable to control movement, involuntary movement. And when you have the back part of the brain, the cerebellum being affected, they tend to present with what we call tremors. And in addition to that, they have problems with their gait and also with their balance. So cerebral palsy depends on the part of the brain that is being affected. Now, what are the things or what are the causes of cerebral palsy? A person can have cerebral palsy right from when they're in the womb, in pregnancy. Some also get damage to their brain in the process of being given birth to. Now, things that predisposes to damage to the brain include infection during pregnancy or even at birth, exposure to radiation, and at times condition that causes lack of oxygen, especially when there is a problem with the placenta, because the placenta is involved in exchange of gases as well in pregnancy. Sadly, cerebral palsy is permanent, but it's a non-progressive brain condition. Now, what are the how are the ways that you can diagnose cerebral palsy? Most of the time, the diagnosis is clinical. In some children, they manifest very early. They tend to get very irritable. They tend to have loss of muscle tones. They are not, you notice that they are not able to hold up their neck when they should. They tend to be really floppy. And you notice abnormal reflexes as well. Some might have delayed a manifestation of the symptoms. So that's why it's absolutely very important that we keep an eye on our kids' milestones so that we're able to um, get early detection and also management of cerebral palsy. Now, what is the treatment of cerebral palsy? The treatment for cerebral palsy is a multidisciplinary approach that involves clinicians, therapies, rehabilitation, and the doctor that takes care that helps to manage cerebral palsy are called the neurologists. And the therapists have a very huge part to play, both physical therapy, occupational therapy, to optimize their activity of daily living. Because what we see is a lot of times these kids don't get physical therapy and occupational therapy, and they tend to have, they get really stiff and they tend to have contractures as well. In addition to that, some of them may even require surgery, either with orthopedic doctors or depending on the kind of surgery to help alleviate um, the symptoms that they have. So I'm going to talk about the myths surrounding cerebral palsy in Africa, and this is really very concerning. And again, one of the main focus of the Necessary mission is to create an awareness and to educate people on various types of disability and to change the narrative around disability in Africa. Unfortunately, in Africa, children with cerebral palsy are being seen as possessed children, demons, or even snakes. Now, the involuntary movement that they have, the slow rhythmic movement, that doesn't make them snakes. That's because the part of the brain that is concerned with involuntary movements has lost control. They do not have control because that part of the brain has been damaged. They are not snakes. They are not possessed. They are individuals as you and I. Stop the name calling. Retard. Those are not good names. We need to stop. We need to change the narrative. We need to come together and support families and children of living with cerebral palsy. They deserve equal rights and inclusion into the society as you and I. Again, some of the other treatments some of them might get includes also getting Botox, and but this is a lifelong thing. For some of them that have mild form, they're able to go to school, and for those that have moderate form, some of them might be able to be trained. And if they're not able to train, you want to make sure that we optimize and we give them a great and good quality of life. So please, once again, this is to address um, our society that this disease is not contagious, it's not infectious, and their parents didn't do anything to deserve this. We need to change the story. We need to create awareness so that those people are being integrated into the society as you and I. Thank you very much, and I'll see you again. Have a good day. Bye.